What is up, you guys? Welcome back to our class, and this is your Pharmacy Informatics week number 4. And for today's topic, we'll be talking about evidence-based practice that focuses on your drug information dissemination. Let us first have our learning outcome for this discussion. Our learning outcome is to demonstrate knowledge on using systematic evidence-based approach to answer drug and health information questions. Pharmacists plays an important role in patient care and safety. Recent reviews of the literature in answering patient queries show that pharmacists' interventions have a positive impact on patient outcomes. In order to make evidence-based decisions about patient care, pharmacists must know how to access and evaluate the current medical literature. Pharmacists must know how to access and evaluate the current medical literature. Our main keyword for this topic is about evidence-based practice. But the question is, what is your evidence-based practice or your EBP? Your evidence-based practice has a concept of having the combination of best research evidence, clinical expertise, and patient values in achieving optimal patient care and in making patient care decisions, or simply decision making. And with that in mind, it is important to acknowledge that using a systematic approach to finding the best available research evidence is very much essential. Remember guys, kailangan nating sundin kung paano yung pagkakasunod-sunod para mas maganda yung flow ng pagbigay natin ng information sa ating pasyente. Before knowing the framework for EBP or your evidence-based practice, let us be familiar with the very first systematic approach which was first developed in year 1975.
Wow!
So, ganito kasi yan guys. Pag sinabi nating systematic approach, paano natin sasagutin yung tanong ng pasyente natin or ng customer natin in a way na systematize, ewan kung may word na systematize siya, or in a way na systematic yung paggawa natin ng information na ibibigay natin sa ating pasyente. So, paano ba yung flow ng first systematic approach natin? First step na ginagawa nila is to classify the request or simply classification of the request. Second is obtaining background information of the requester or simply the patient. Third step is to do a systematic search. Alam na natin yan dahil na-discuss na natin yan. And fourth is to present your response. And with the last step, having a reclassification of the information. So, ganyan yung pinakaunang systematic approach sa ating mga queries or sa mga requests for information, guys. Wow! Now, let's proceed to the framework for your EBP. Ano na ulit ang EBP? Evidence-based practice. So, sa framework for evidence-based practice, meron tayo, guys, 6 steps. Ano yung first step natin? First is asking questions. Second is search. Third is called your critical appraisal. 4 is implement. 5 is evaluate. And 6 is dissemination. Iisa-isahin po natin yan.
Wow!
So let us start with our first framework, which is asking question. Asking question is about organizing the clinical question in a structured format, like the use of your PICOT format. Again, PICOT, your P-I-C-O-T. Your PICOT promotes retrieval of articles that are closely related to the clinical question. Meron tayong example. Okay, so nakikita nyo ngayon guys sa table 11.1, your PICOT, which is used in formulating an answerable question. Makikita nyo sa description, we have there your PICOT, P for patient, I for intervention, C for comparison, O for outcome, and T for time. So example sa ating P is an hospitalized adult patient with recurrent methicillin-resistant Staphylococcus aureus bacteremia. So yun yung problem natin. Our intervention is to use your linezolid as a therapy. Comparison for your linezolid is the standard care, which is your drug, vancomycin. The outcome na gusto naman nating makamtan is effective infection clearance. Now let us have our second framework, which is about search. So in search, there is the utilization of concepts and keywords, which is very important to filter out articles that do not fit the clinical question. Again, sa search natin, kailangan alam natin yung concept na gagamitin natin, at isa sa pinaka-importante ay ang paggamit ng tamang keywords. Next framework or next step is called your critical appraisal. Critical appraisal is simply the evaluation of the medical literature by using 3 key questions. So what are these 3 key questions? The 3 key questions includes: are the results valid? So does the medical literature provide a result that is valid? Next question is, are the results significant? So you need to evaluate results of the study if they are statistically significant. Ano ba ibig sabihin pag statistically significant? When we say statistically significant, it means that an analyst has conducted a determination from which the results in the data are not explainable by chance alone. So, ibig sabihin, yung resulta ng experiment or nung research is hindi may explain na chance lang yun kaya nagkaroon ng ganun. Nakuha po, statistically significant. Next question is, will these results help determine care for the patient? So, can the medical literature or the study help treat our patient? Next up for our framework is the fourth step, which is called your implement. For implement, we need to implement findings by creating an action plan based on evidence from the literature. And now let us have our second to the last framework step, which is called your evaluate. After implementation, it is a must to monitor and evaluate patient and quality outcomes. And so for our last framework step, which is called your dissemination. So this is simply dissemination of information. So your dissemination of information provides support to the EBP process and promotes improvement in clinical practice particular to your decision making. So it promotes decision making. Please do note that pharmacy schools with drug information course usually employ the use of the modified systematic approach in answering drug information. Okay, bale ang na-discuss ko na sa inyo guys is the first systematic approach, and the second one is the framework of doing your EBP or your evidence-based practice. So dalawa, okay? Ngayon, ang ibibigay ko ng next topic is called your modified systematic approach. Ito na po yung tinuturo sa halos lahat ng pharmacy schools with drug information course. So let us have your modified systematic approach, and we have 7 systematic approach. Remember, pharmacies are sought by other medical practitioners about medication use and safety. So this modified systematic approach plays a very important role in performing our duty as a pharmacist.